Welcome to our second patient education series for addressing the eyes. Our topic for today is a description of the available eyelid procedures. There are 5 specific procedures for creating a more youthful appearance to the eyes. Number 1 is the upper blepharoplasty or upper eyelid lift. Number 2 is the lower blepharoplasty or lower eyelid lift. Number 3 is transconjunctival lower blepharoplasty. That's a lower eyelid lift without a skin incision. Number 4 is a brow lift. And number 5 is non-surgical procedures to improve the skin and soften wrinkles due to thinning of the skin and muscle movement around the eyes. Any of these 5 procedures or combinations of them may be what's needed to gain a more youthful appearance. In general, there's usually more skin to remove from the upper eyelid than from the lower eyelid, but it is important to note if the excess skin of the upper eyelids is actually due to skin laxity and redundancy of the upper eyelid or due to a brow that has dropped, because these require different surgical techniques. If the brow is in a good position, then the excess skin of the upper eyelid would need to be removed. However, if the brow is in a lowered position, then the brow lift may correct the appearance of the excess skin along the upper eyelids. Sometimes both the brow lift and the upper blepharoplasty are needed to correct the aged appearance of the upper eyelids. In those circumstances, the brow lift is performed first to see just how much excess skin is actually present along the upper eyelids. Reversing this order may result in too much skin being removed from the upper eyelids, which would compromise the patient's ability to close their eyes completely. In the lower eyelids, there is usually puffiness or bags that concern the patient. Surgery is required to address the fat pads which are causing the puffiness. Some patients develop puffiness of the lower eyelid without any changes in the skin itself. In these individuals, there's no need to remove skin from the lower eyelids, and they benefit from fat removal or fat repositioning alone. These are generally younger patients who are genetically predisposed to this fat pad protrusion. They are candidates for addressing the fat from inside the eyelid without the need for an external incision. This procedure will be discussed in detail in the patient education series titled Transconjunctival Blepharoplasty. If the only concern is the presence of crow's feet around the eyes, Botox Cosmetic may be used to soften the wrinkles without the need for surgery. If the concern is the fine lacy pattern of wrinkles along the lower eyelids, this is due to breakdown of collagen and elastin. Surgery will not add collagen nor elastin. Usually these patients benefit from skin tightening procedures that stimulate the skin to make collagen and elastin, such as laser resurfacing or radiofrequency treatments. If hollowness is the major contributing factor to the aged appearance around the eyes, then patients may benefit from soft tissue filler placement or fat transfer along the tear trough to correct the deficiency. But be cautious when having placement of fillers or fat around the eyes. It's better to undercorrect than overcorrect, because it can be very difficult to remedy overcorrection, especially if it is from a fat transfer. As you can see, there are many options for different conditions causing the aging changes around the eyes. This patient education series is intended to increase your understanding so you will always make better informed decisions in your care and make better choices. Please join us for our next series, which will address upper blepharoplasty in great detail. Thank you.